Hi, everyone. Thank you for joining us today. We'll be starting shortly. We're going to give people a little bit more time to check in. We'll be back in just a moment. Good afternoon, everyone. My name is Nicole Sirach, physical therapist and clinical director at Spear Physical Therapy and Occupational Therapy at our Brooklyn Heights location. I'd like to welcome back those of you who attended one of our other webinars and welcome those who are joining us for the first time. We appreciate you taking the time out of your busy days to learn with us today. For those who do not know who we are, Spear is a private outpatient practice that has been around for over 20 years with currently 20 locations located all over the New York City area. We were recently awarded the nation's top physical therapy practice for the second time since 2016, which is something that we're very excited and very proud of. We have successfully continued to offer in-person care through the COVID-19 pandemic, as well as launch Spear Live, our telehealth platform for those who are looking to stay in and receive care from the comfort of your home. In our clinics, we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone. You can find more detailed information on those safety measures by visiting our website at spearcenter.com. We are here for you in whichever way makes you most comfortable. If you are looking for individualized care, either in the clinic or through telehealth, please reach out to us and we'll get you set up with an appointment right away. Since the pandemic began, we have received many questions from our expecting patients about pain related to pregnancy and the pelvic floor. Some of you have joined our previous pelvic floor webinars, and today the focus will be on pregnancy specifically. We are excited to be able to offer advice and education, as well as answer any questions at the end of the webinar. As part of our session, we will be discussing and demonstrating some exercises, and we welcome you to follow along and practice with us if you feel comfortable. Please note, though, that if you're experiencing any pain while performing any of these, please stop and reach out to us directly so that we can support you. And as you can see, we are coming to you live from our own clinics and homes, and although we do not anticipate any technical issues today, please be patient with us should any arise as we navigate through working with this technology. And I apologize for any possible dog barking as well. So a couple housekeeping. Throughout the webinar, we want to hear from you. If you have any questions, please feel free to ask us in the Q&A feature. To find where that is, please take a moment to hover your mouse at the bottom of your screen. You will see a Q&A option pop up. That is where you will find the question, where you put the questions, and we'll do our best to answer as many as we can during the webinar. It's best to put these questions in the Q&A. If you put questions in the chat feature, we may not be able to get to them during the webinar. For those who are watching through YouTube Live, we are monitoring the comments section there as well, so please feel free to type your questions in. Lastly, there will be times where multiple panelists are on the screen. For the best viewing experience, please select Gallery View, which is at the top right corner of your Zoom screen, so you will be able to see multiple panelists at one time. So we have a lot of exciting things to talk about today. So let's discuss what our goals for the day are and what we will be covering. So first, we'll discuss physiological changes that occur during pregnancy. We'll explain common diagnoses of the trunk, back, and pelvis you may experience. We'll demonstrate exercises for you to safely manage your pain. And we'll discuss ways for you to prepare for labor and childbirth. And at the end, we will also leave time to answer some questions that you have. So before we get started, I'd like to introduce our team of panelists. We're going to welcome everyone onto the screen right now. Hi, everyone.
Hey.
So I'm really excited to introduce our team of panelists. Our first presenter is Sarah Shoemaker, pelvic floor therapist from 95 Chambers Street.
Hey guys, thanks for joining us.
And we have Emma Codman, pelvic floor therapist from Union Square.
Hey guys, excited to be here.
And lastly, we have Chris Cottrell with us, who is the assistant clinical director and physical therapist at our Brooklyn Heights office. She'll be helping us with answering your questions in the Q&A today.
Hi everyone, welcome.
Just as a reminder to everyone, it's best to be in the gallery view so that you can see everyone at the same time. Sorry, that's my dog you hear in the background making some noise. But so if you put yourselves in us in the gallery view, if you've done that, you should be able to see all four of us right now. Okay, so Emma, Chris, and I are going to say goodbye for now. Sarah will let you take it away with information on how our bodies may change during pregnancy.
Yeah, thanks, Nicole. All right, guys, we're going to start off with a quick poll to kind of see where you all are in regards to what we're going to talk about today. All right, so the first question up, you should see, those of you who are pregnant, are you experiencing any sort of low back or pelvic pain due to this pregnancy? Just a simple yes or no. All right, we'll give you a little bit of time to answer. All right. I wonder how many of you really are pregnant. Let's see. All right, while you guys have quickly answered, let's say, oh my gosh, a 50-50 split. All right, interesting. Okay, we're gonna quickly ask one more question and kind of see if it compares to what the research shows out there. All right, so in general, what percentage of women who are pregnant experience some sort of pelvic girdle pain, right? 50%, kind of like what we just saw, 20%, or 10%? Let's see what kind of guesses you got in there. So if you have any pregnancy-related knowledge. All right, also if you've already answered the question and you have a pillow or a towel close by, you can quickly grab that for some of the exercises we'll do later. No worries if you don't have anything handy though. All right, look at these results. All right, 68 of you think it's about 50%. All right, nobody thinks 10%. Good to know, good to know. The answer is 20%. The one thing here, it doesn't include the low back pain, but we'll get back to these numbers a little bit later in the talk. But that just shows you how common these conditions really are. And lucky for you, there are ways to manage these symptoms before giving birth. All right, so let's start about some of the physiological changes going on during pregnancy. Hormones are going wild right now, and I'm sure you all know that. We have an increase in our estrogen, progesterone, and oxytocin, just to name a few. Our estrogen levels actually increase 30-fold. So this is the biggest player in our skeletal changes because estrogen contributes to the softening of our tissues, causing weaknesses and tightness in new areas, especially around our hips and trunk. Progesterone, on the other hand, decreases our feelings of alertness and focus, which can cause what some call mommy brain, or that foggy feeling felt even early on in pregnancy. Another key factor is our oxytocin. This hormone stimulates uterine contractions for labor and is also known as the feel-good hormone that promotes infant bonding and decreases postpartum depression symptoms. Cardiovascularly, because of the space the baby is now taking up as he or she grows in your abdomen, we recommend that you avoid laying on your back after 20 weeks gestation to prevent any increased pressure on those large vasculature in your abdomen. So laying on your side is always better. You may also note taking deeper breaths or feeling very out of breath during your pregnancy. This is because there's actually a 20% increase in oxygen consumption needed to provide to the baby. And there's also, because of that growth within your abdomen, there's way more pressure now on your lungs. So a major musculoskeletal change, as therapists we see commonly, is changes in our joint stability. So if you look at this pelvis model, you can see we have our two hip bones, our sacrum, and some of our lumbar spine. This shows how many joints are actually involved in the pelvic girdle. There's 22 to be exact. We also have ligaments that hold our hip bones to our spine and our sacrum, which you can kind of see right into here. And this, fitting like puzzle pieces, we call our form closure. We then have a ton of muscles that sit on and around and up your spine that we need to stay strong to support all of these structures together. We call that our force closure. So to ensure we have enough stability and strength in this region, we need to stay fit and keep everything together, especially as you progress through pregnancy and those hormones continue to run its course. So there's also some other changes that Emma's now going to talk about involving your core. So let's bring Emma back in here so she can go over some stuff.
Hey guys, thanks Sarah. So the next thing I'm going to talk about is a little bit more about your core. So I have a nice picture of it here. If you guys don't mind pulling it up for me, the picture of the core for Diastasis Recti. So Diastasis Recti, you guys might have heard of it before, is actually just abdominal stretching during pregnancy. So you can see in this picture on the right, and this is actually a natural physiological change that happens as the baby grows and the abdomen expands. So the connective tissue in between the abdominals is going to be stretched, which causes some separation. A fun fact is actually that research shows that 66 to 100% of pregnant people will experience this by the end of pregnancy, which is super interesting and common. And typically, you know, these muscles will go back to their normal length following birth. However, sometimes the split can persist. And if this happens, don't worry at all. Just come see a pelvic physical therapist and we'll take care of you. So we'll keep this slide on because I'm going to talk a little bit more about the pelvic floor next. So let's chat about it. The pelvic floor muscles, as you can see, are actually in the picture on the left, right at the bottom there. So you can see they kind of stretch from your tailbone to your pubic bone there. And these muscles support your internal organs. They help control bowel and bladder function. And during your pregnancy, you might notice more pressure in your abdomen and on your pelvic floor. So as the baby grows, there's going to be a little bit more pressure on your bladder as well, which might cause you to need to run to the bathroom a little bit more often than usual. And so if you're experiencing this, it's nothing to be too worried about, even though it is inconvenient. This pressure on the bladder is just making it feel fuller a little bit faster. So you'll likely be running to the bathroom more often these days, but it should go away after you give birth. Just let us know and come to PT if it doesn't. But more on the pelvic floor later. We can get rid of this slide. So there are many different changes occurring, which could cause pain throughout your pregnancy, right? So Sarah and I are going to cover the ones that we see most often. And just so you know, the goal of physical therapy is to kind of just manage the pain felt, right? We can never actually totally eliminate the pain just because there are constant changes occurring throughout your body. So what we're going to do today and what we always do in physical therapy is give you the tools to manage your pain as your body grows and changes. So first thing I'm going to discuss is called round ligament pain. So I have a nice picture of it here. As you can see, the round ligament is there in the picture on the left, and it attaches from your pubic bone down there to your uterus. So as your baby grows, the ligament is going to stretch with it, which could cause some discomfort in that area, as you might imagine. The pain can sometimes be sharp in nature and is worse with movements like standing up from a chair, any type of transition like putting shoes on or getting out of bed. And to help ease this pain, we'll go over a couple of supportive bands a little bit later that might help address the symptoms. And you can also massage your lower belly to help relieve the symptoms of the pain. That's going to feel really good. Of course, you should always be checking in with your doctor as your pain changes throughout your pregnancy. Okay, Sarah, come on back, and Sarah will go ahead and discuss some common back pain and pelvic pain issues.
Loved it, Emma. Thanks. All right. Shout out to Herman and Wallace for the course that they provided, and they had great pictures. So I'm going to show one right now to kind of give a nice, easy way to distinguish between pelvic girdle pain and low back pain. So as you can see, the picture on the left, the low back pain, on the right, sorry, the one circle in the middle around the low back shows that the low back pain typically located right there and can extend all the way down your leg to your foot and ankle. Whereas the pelvic girdle pain typically stays localized in either the front or back of your pelvis and will not extend beyond your knee, as shown in this image. Pregnancy-related low back pain may present as tight muscles in your back and into your glutes. There may be some nerve symptoms that extend down your leg. This pain may increase with bending forward and improve with walking or standing. And it typically starts during the second trimester or even started before pregnancy. Whereas pelvic girdle pain typically arises in the first trimester. And there are two different types that we like to distinguish between. You have anterior pubic symphysis pain, which is very located to the front of your groin area, or posterior sacroiliac pain, which sits deep, deep, deep down low in your back. It typically feels better with bending forward and worse with arching your back. And it can increase with being in any position for too long, so you may feel pretty antsy because of these symptoms. With this, the pain is usually worse in the morning and at the end of the day. As mentioned earlier, that pain is centered in either the front or the back of your pelvis and may extend into the groin or deep into your hips. So a little bit later, we're going to go over some different ways to manage these impairments. We're now going to bring Emma back in to discuss specifics about your pelvic floor.
Hey guys, thanks Sarah, good info.
Yeah, let's see what you got.
All right. Okay, so earlier I talked about some normal pelvic floor changes during pregnancy. So now I'm going to briefly review some common but not normal changes that can be addressed by a pelvic floor physical therapist. So when one portion of your core muscles, including your pelvic floor, is too tense or too weak, it can throw off other areas, right, by making them work harder to support you. And actually, studies show that there is an increase in low back pain with any type of like urinary dysfunction or pelvic floor overactivity or issue. So this is because of that increased pressure throughout the core area that we talked about earlier. Because of the pressure on the bladder as well that I discussed earlier, urinary leakage is a pretty common issue during pregnancy. And stress incontinence, to kind of like break it down further, is any leakage that occurs with increase in abdominal pressure. So like leaking urine when you cough or sneeze or are doing any type of heavy lifting or exercise during daily life. So that's pretty common. And if that's happening, you can definitely come see us. We'll go over some exercises a little bit later on to help strengthen your pelvic floor, which will be exciting. Now, speaking of exercises, I'm going to bring Sarah back on screen and we'll just talk a little bit about some exercises to help alleviate your pain.
Yeah. All right, Emma.
All right, I'll have you be my model. Okay, so
Perfect.
We're going to go over just some exercises to help out with the issues we just discussed. So first, I'm going to talk a little bit about diaphragmatic breathing. So diaphragmatic breathing is going to help with overall core strength because it uses your abdominals and the diaphragm, which is the muscle that helps you breathe. So Sarah, I'm going to have you sit up straight and you can be on your physio ball if you have one at home or, oh, perfect. Oh my gosh. Awesome. Good job. You look great. Okay, so go ahead and sit up straight. You can do this in any position, but sitting is the easiest way to start. And Sarah, I'll have you go ahead and put your hands on your chest and your abdomen. So one in each spot. Nice. Now we'll start taking some deep breaths and I want you to actually send your air into the belly as you breathe in. So you should feel your hand on your belly expanding more than the hand on your chest. How's it going, Sarah?
Yeah. You definitely have to think about it, but.
Definitely. Yeah, it's a hard one. We don't usually breathe like this. So as you get better at this coordination, you can think about sending the air into like your whole core, right? So think about expanding your abdomen and chest 360 degrees as you breathe in, and then just gently exhaling and collapsing everything down. Still going okay over there?
Yeah.
Good, good. And so to make this exercise more challenging, you can try it on your hands and your knees. You can try it standing up or laying on your side, all just different positions. All right, Good job, Sarah. So next we're going to talk about the deep core. I call this the transverse abdominis, or I'm going to nickname it the TRA for short. So this muscle is going to help support the core and prevent diastasis after pregnancy. It's also going to improve low back pain because it's going to help stabilize things. Nice. So activate it. Sarah, will you help me again? I'm going to have you start laying on your side. Are you okay with getting down on the ground?
Yeah.
Yeah, I'll give you a second.
Perfect.
You guys can totally follow along at home as well. I forgot to even say that. Yes, if you guys want to go and try all the different exercises, you can just follow along with us.
Can you see me?
Yeah, no, it's perfect. Good. Okay, lay on your side, nice, knees bent, very good. Great. Doing okay? Oh yeah, pillow.
I gotta get comfortable.
Gotta be comfy. Yeah, if you're gonna exercise, might as well be comfy. So Sarah, I'll have you put your hand on your hip bone, perfect, just like that. And I'll have everyone at home to just walk your fingertips like slightly towards the middle of your belly. And we're gonna go back to that diaphragmatic breathing. So as you breathe out, so you've already breathed in, you've expanded your belly, and then as you breathe out, I want you to draw your belly button into your spine and kind of just gently tighten your abdominals. And you should feel, that's why I had your hand there, just a small bulge into your fingertips. Sarah, how's it feel?
It's small, right?
Yeah, it should be really small, just a gentle tightening. These muscles are so deep that it's a little bit hard to feel sometimes, but you should feel a little bit. Cool. All right. So this is a great way to find these muscles, and you can practice holding this contraction for like 3 to 5 seconds or so and progress for 3 sets of 10 reps. Once you're confident with this, you can do it again in different position on your hands and knees, standing or sitting on a physio ball, which I'm sorry to make you change positions so much, but I'm gonna have you sit back on the ball. Nice. I like your pants.
Thank you. It was a weird day this morning, so I figured I should bring some sunshine.
I love it. It's great. Okay, so these deep abdominals, good news, can actually also help us activate the muscles of the pelvic floor. So Sarah, I'm going to have you demonstrate for me in a second, but a strong pelvic floor, as I kind of discussed earlier, can actually help alleviate and prevent any urinary leakage, right? And it also helps stabilize the entire pelvic area to help with some of that pelvic girdle pain. But if you ever do feel pain with this exercise, guys, definitely stop right away and tell a doctor or come see us at Spear. So the TRA and the pelvic floor are going to work together right now. I want you to, Sarah, take a big deep belly breath in. And this time when you exhale, you're going to activate your TRA and see if you can pull those muscles on the physio ball up off the physio ball. Almost like you're picking up a blueberry with your vagina. How'd that feel?
It's hard to get it, but the blueberry helps.
Cool. No, that's good. I really like that analogy. I think that's my favorite one out of all the different analogies. So guys, a physio ball is an awesome thing to have for this exercise just because of the feedback, but you could also sit on a pillow too at home. All right, we're going to do one more, a little bit harder. Sarah, you ready?
I don't know.
So now I call this an elevator. As you breathe out, I'll explain it to you first. You're gonna activate the pelvic floor a little bit, and then a little bit more, and then a little bit more, just like an elevator in a building. So I'll have you go ahead and try it. It's like a slow, controlled exhale and activation.
Yeah, that takes a lot of like imagination.
Definitely, but I think sometimes people feel like that's easier because it takes like more time to activate. Yeah. Cool. Nice.
Slow and controlled.
Slow and controlled. Love it. All right. So back to you, Sarah. I think we'll both stay on the screen and now you can instruct.
Yeah. All right. Yeah. I'm going to use you as my model now.
Perfect.
I'm going to get off the ball so I don't fall. But we're now going to go over ways to stabilize that hip and pelvis. All right, like I mentioned, not only do those bones need to be nice and supported, like fitting together like puzzle pieces, but those muscles also have to be strong and active. So we're going to focus on the inner thigh muscles and your outer glutes. So Emma, we're going to start in a sitting position and really remember to engage that transverse abdominis to start. Okay, so give me a few breaths just to warm up a bit. And then what I'm going to have you do is take your two hands and just put them on the outside of your knees. Okay, we're going to kind of play tug of war. You're going to gently push your hands into your knee as your knees and legs kind of push out. Okay, all we're doing is trying to activate those outer glutes. Do you kind of feel them engage?
Yeah, I feel my butt.
Yeah.
That's awesome. Cool.
All right. So let's hold that for just a few seconds, just so you feel what we're supposed to be feeling. Now we're going to do the opposite and engage your inner thighs to really keep both sides of your hips and pelvis engaged. So now you're going to take your hands, or you can take a towel roll, a ball, a pillow.
I was prepared.
Perfect. I'll do it over here with a pillow so you can see that the same thing happens in both positions as I cut my head off.
Oh yeah, my head's cut off too. Sorry guys.
That's all right. So all you're gonna do is gently squeeze the ball so you feel your inner thigh engage, and you should be engaging that transverse abdominis throughout. Good. And relax. You can incorporate your breathing with this too. So relax on the inhale. Gently exhale, pull in your belly, gently squeeze the ball. Good, and relax. So once you get the hang of this, you can do this for 3 sets of 10, hold for about 3 to 5 seconds, and you can make this into more functional things. Instead of using your hands on the outside, you can put on a resistance band, which is going to bring us into a progression. And I'm going to have you come lay on your side if you don't mind.
Sure.
So we are now transitioning into an exercise we call a clam shell. You're activating that same butt glute muscles, just in a different developmental position. So Emma, all I'm going to have you do, keeping your shoulder, hip, and ankles all in a straight line, you're going to gently open and close your knees as if your legs were a clamshell. Simple as that. The biggest thing is you don't want your trunk to start rotating backwards as you lift your leg, because then we're not using our glutes, we're using the rest of our body.
Yeah, it's hard to keep my hips stable. They really want to rock back.
They want to rock. Yes,
Yeah.
Once you get really good here without resistance, you can throw that resistance band on, and you can even put the ball between your knees and get both at the same time.
Let's see if I can demonstrate this
That's
quick.
it.
The people at home.
Don't forget to work both sides too.
Yeah, so I've got out and then
Gently squeeze in, hold for a few seconds, relax.
I like this one, Sarah.
Yeah.
Nice.
They make fancy balls that have both things. That's what I use in the clinic. There's a whole exercise program on it, but it's fine making your own.
Cool.
They do the same thing.
Nice. Thanks.
All right.
All right.
So, Emma, do you feel worked out?
Yeah, a little bit. It's good.
All
I
right.
haven't worked out yet today, so.
All right. So we're now going to go over some different belts and stuff to go on from not only getting relief from exercise, but some support systems that Emma quickly mentioned about the round ligament pain. All right. So if you can see here, we have some supports for pelvic girdle pain, some supports for the low back and the abdomen, and then pillows. So to alleviate that pelvic girdle pain, we have a few brands that we've recommended in the past. It's a Sorola. They also have the SI Lock. These are typically for the back pelvic girdle pain, but you can also wear the same belts a bit lower on your hips to really get that anterior pubic symphysis pain. The other belts, the low back and abdominal supports, you have the mother-to-be, which has that strap over your belly, which I would recommend taking off at the top. No need for that, and it's easily removable. You also have a mini cradle, or there's one called the baby bump belt. They really alleviate the pressure and the strain on your stomach and really offload that belly from your hips. All of these belts and supports are on average $40-ish. So if the pain is severe enough, these will definitely be worth it. And I have plenty of patients that as soon as they put this belt on, their pain is gone and they feel so relieved. So you can also use some different pillow supports. Since we mentioned, and I'm sure your doctor has told you too, we should not be laying on our back, especially with sleeping. So a common brand is the Snoogle, which is the picture in the middle. But in these New York City apartments, I'm sure you don't have space in your bed for you, this pillow, your partner, and whatever animals you also have. So you can use one of those generic straight body pillows or a bunch of regular pillows and just get them positioned enough so you're in a nice neutral alignment, and pillow between the knees, under the head, and so on, just so you don't start getting any pain from prolonged positioning. All right. The ultimate goal is to get everything aligned so you're not curled up in a ball and then wake up in pain. Another disclaimer is we don't have any specific financial interest in any of these products. They're just general recommendations on what our patients have found beneficial. So just want to get the word out there of what others have really enjoyed using. All right, some of you may be asking yourself, how in the world do you prepare for this labor and birthing process? So I'm going to bring Emma back in, and we're going to go over some additional exercises and stretches.
Yeah, sure. Thanks, Sarah. Yeah, all those belts are so awesome. So seriously, worth the investment.
Yeah.
If you guys are experiencing those issues. Okay, so a little bit more on giving birth and how we can prepare for that, right? So the pelvic actually needs to expand and relax during birth, right? To allow for the baby to pass through the vaginal canal. And, you know, although nothing can guarantee a smooth labor, of course, we're going to go over a couple exercises to help kind of lengthen your pelvic floor muscles to prepare. And I'll have Sarah demonstrate them if you don't mind.
Excellent.
Okay, and so all these stretches should be held for 10 slow and controlled belly rests, that diaphragmatic breathing that we talked about. So first we're going to do an inner thigh stretch, right? So I'm going to have Sarah stand at the edge of the table, very nice, in a wide stance, and you can kind of prop your elbows up. Good. And you're going to go ahead and shift your hips to the side until you feel a stretch on the inner thigh. Awesome. Hopefully you guys can see. I think that's okay, Sarah.
That's good.
Yeah, I can see you. Great. And really nice. How is it feeling over there?
It feels good.
Yeah. Cool. Yeah. And again, just slow, gentle stretch. So this one I like to hold for 10 seconds or so, just while doing the big, deep belly breaths. And go ahead and switch sides, Sarah. And we'll just rock from side to side. This is a great one just to go ahead and stretch the pelvis. For the next one, Sarah, I'm going to have you grab a chair. Do you have a chair in there?
I'm going to unsafely use my stool.
Oh yeah, guys, please don't try this at home. Use a stable one. Oh no, that stool would be good. The non-rolly one, right?
Okay, this is good. Okay.
Yeah, let's do that one. I don't want you rolling off the chair. So perfect positioning. You're gonna step one foot up on the chair or the stool, and you're just gonna kind of rock forward onto your front leg. Nice.
Where should I feel this?
So you should feel this in the front of your hip. On the standing leg, yes. Oh, sorry, the left leg, yeah. They're both kind of standing. Good. And again, you should kind of slowly rock, gently let everything relax. Good. And you can also do this to the side. So I'll have you switch facing me and then kind of rock inwards that way. And you'll feel more of that inner thigh that we were just working. Good. Okay, ready for one last exercise?
Yeah.
So go ahead and sit back on your physio ball.
Oh.
We're gonna work on, so this one is actually to help your pelvic floor kind of actively relax for birth. And it's almost like a reverse Kegel. So at home, I'll have you sit on your physio ball if you have it, or like a pillow, just so you can feel that feedback I was talking about earlier. And so we call this a pelvic floor drop, since you're dropping your pelvic floor down into the surface that you're sitting on. And this should happen at the end of your big diaphragmatic breath. So go ahead and take a big deep inhale. And as you inhale, Sarah, I want you to imagine the air is being sent down into your pelvis, and see if you can gently feel the pelvic floor like expanding down into the ball. This one's a little abstract, so it's a little bit more challenging. How is it going?
Can I like use the elevator?
Yes, exactly. Perfect. So yeah, if you're on like the first floor, you want to drop it down to the basement instead of coming up to a higher level floor.
Okay. Like I'm pushing down into the ball.
Yeah, exactly. Yeah. At the end of your exhale, everything's kind of like opening and dropping down into the ball.
Okay. Yeah.
So yeah, so this one definitely super important to sit on a pillow or physio ball just for that feedback. I think it'll be easier for you guys at home.
Yeah, definitely.
All right, back to you, Sarah. Let's wrap it up.
Yeah. All right. I'm now going to go over some stretching of the perineum, which we quickly brought up before, and some different positions to assume to help alleviate some of the pain during the birthing process. So the first technique is a perineal massage, and you're probably asking, what is the perineum? Do you see this black circle right in between the vaginal opening and the rectum? This area in here is what we're trying to stretch, because to decrease risk of any tearing during the birthing process. And we typically educate our patients to start doing this around 35 weeks. This stretch can also help get you primed for that sensation of the baby crowning. Research also shows benefits of these stretches include less pelvic floor tearing, less stitches needed following birth, less pelvic floor pain, and greater sexual satisfaction and sensation postpartum. And who wouldn't want that? Another key thing is that there's no risk in overstretching this area. So if you see where we're trying to stretch, then the other picture here kind of shows how to stretch it. What you're going to do, first make sure your hands are clean and washed. You want to find a very comfortable position. You're going to insert either a thumb or finger right at the vaginal opening, and you can use a water-based lubricant. You're going to provide a steady pressure downward toward the rectum, and with your controlled breathing that Emma taught us, hold for about 60 to 90 seconds. You then maintain that same pressure, and you're going to slowly slide your fingers up and out as if you're making a U. You can kind of see it in the top picture going from 6 to 9. All right. If you don't feel comfortable looking down there or doing this on your own at first, you can always come see one of the pelvic floor specialists at Spear, and we can go over it. You can complete this for about 5 minutes every day. I like to tell my patients to do it in the shower or bath or right after, so all of that tissue is also already very warmed up. You can even have your partner join in and help with these stretches. But remember, please stop doing this and call your doctor if there's any vaginal bleeding and or preterm labor contractions begin. So we're done with the perineal massage for now. Let's talk about different labor and birthing positions. So the most common labor position is the mom being positioned on her back with her hips and knees bent really far up. This position does not allow for the pelvis to open as much as we need for the baby to pass through the vaginal canal. It is important to have different options for your birthing process, but remember, you may not be able to follow that plan due to complications with monitoring, other labor issues, or regulations in the hospital. So let's now talk about the options you can try. Sideline during the laboring process is optimal to minimize that perineal tearing. Laying also can slow a rapidly progressing labor due to the decrease in gravity assistance. You can be quadruped on your hands and knees or kneeling over a physio ball to alleviate some of that pain you're feeling in your pelvis, your hips, and that pubic symphysis or that SI pain. And it also allows the pelvis to really open up than getting it compressed on your back. A deep squat can also help and feel really good on your low back and pelvic pain, and gravity assistance is maximal here. It's really helping, but you're at an increased risk of tension and tearing of your perineum. I'm going to show you quick what that quadruped and kneeling position may look like. A lot of hospitals, or you could bring your own, have physio balls, and all you would do is kind of lean over it here, and you can rock a bit, and so on. So we hope you have a better understanding of what may be going on to help alleviate some of your aches and pains. But remember, if anything doesn't feel right, please come see one of us and we can help. But we're now going to bring Emma and Nicole back in to answer some of your questions.
Good job, Sarah. Crushed it.
Thanks. Nice job, Emma. Let's see what they're going to throw at us now.
Yeah. Hey, Nicole.
That was so great. Thank you so much, Emma and Sarah. I learned so much and we received a lot of questions, and I'm excited to ask our experts. So first question is, Do you have any advice for tailbone pain specifically resulting from pregnancy? Any relief or prevention strategies?
Yeah, definitely. Do you want me to take this one?
You can go right ahead.
Cool. So tailbone pain is very interesting. It can be coming from a lot of sources, and it really depends on if you had the tailbone pain before or after or during. And it can be coming from a lot of different sources. You know, I find a lot of times it's from like tightness in the glutes that can start during pregnancy. A lot of it is like referred pain from the butt muscles. And so what I find really helpful, honestly, is if you could get on like a foam roller and foam roll your glutes, that can feel really, really nice in relieving that tailbone pain. And then if you want and you feel up to it, you could follow it up with some of those clam shells and any type of hip strengthening. And then obviously if it persists after birth, you know, you can come on and see us and we can kind of take a look at your pelvic floor more specifically. Sarah, anything to add?
No, that's great.
Yeah.
Mhm.
Hopefully that helps.
Thank you so much, Emma. So another question. So I saw that you were using the physio ball a lot during your exercises. So do you have any recommendations or tips on how to find out what size physio ball is right for a person based on height, or what do you guys recommend?
Let me see what this one is. I
I'll look
don't
too.
have a specific brand or size.
Oh, I have what size mine is. Mine is 75 centimeters. And actually this one says it fits body heights 6'2" to 6'8", but I'm like 5'5" and it works fine for me. So.
Yeah, I have the same size here. We also have a smaller one in the clinic. I think it's 68 centimeters, which we use more often. So anything within that range, but the box should say the size you need. We don't discriminate, or we don't have any specific favorites.
Yes, yeah. So that's on sizing.
Awesome. Thank you so much. Question, can someone use heat or ice to help with hip, groin, or back pain while they're pregnant?
Yeah, so ice is definitely totally fine. I recently took a course that also mentioned heat is okay as long as you like avoid your abdomen. However, in the clinic, I typically don't use it anyway, just to avoid any risk of any risks. But ice is a nice natural anti-inflammatory and pain reliever. So there's benefits there. Emma, do you have any other?
Yeah, so I would definitely just check in with your doctor, depending on what they say. I do heat for the back is great. Definitely, I wouldn't apply it directly over the belly. Just check in with your doctor and see what they think. I definitely do heat on the back. That can feel pretty good, but I love what you said about ice, Sarah. Definitely that natural anti-inflammatory is awesome.
Great, thank you. So are there any specific exercises that people need to avoid while pregnant?
Yeah, so if you have been exercising pre-pregnancy, there's no problem with continuing to exercise. It's just going to be based on modifications that you need to start making. Your balance is going to start being thrown off, and you're going to have like an increase of weight and all that pressure on your organs. So it's really symptom dependent, but avoid crazy jumping, headstands. Like, don't start doing things you haven't already done.
Yeah, that's what I would say too. Like anything you're already doing is okay. They just don't want you like increasing the exercises anymore. Yeah, good. Definitely no headstands. If you've never been a runner, don't try and start running. But you know, if you're someone who's been a runner all your life, you're probably all good. You know, as long as you feel comfortable to continue running. And just double check with your doctor on that.
Right.
Absolutely, that was super helpful. I know a lot of my patients ask, me that question. So thank you so much for, answering that. How long does pelvic floor physical therapy typically last for?
So it really just depends, it depends on what you need and how you're presenting. I've seen some people get better in just 2 or 3 visits. And then I have some patients who are with me for a few months or so. We're going to do everything we can, to get you back to your goals and what you need to be doing. That just is different, a little different for everyone. Sarah, what do you think?
Yeah, pretty much the same. And pelvic floor is such a wide variety of complications or impairments that could be happening. So there's no rhyme or reason or strict protocol that we follow. So just like Emma said, it really depends on what you're coming in for, how you progress with the techniques that we go over and exercises we do.
Yeah, definitely. It's all tailored to exactly what we find on our examinations.
Mm-hmm.
Yeah.
Awesome. Thank you. Couple more questions. So do you have any specific input or advice related to placenta brevia post C-section, things to do or things to avoid?
Well, post C-section will definitely be covered in our postpartum and pelvic floor webinar that is in November. But the biggest thing is it's going to be symptom dependent, and your doctor is going to be the one to really set guidelines, like for what we then do together in physical and occupational therapy.
Yeah, absolutely. And I think, that's a very, specific, question. And I feel like someone, who's experienced that could definitely benefit from getting an evaluation from a pelvic floor therapist.
Exactly.
Awesome. Great. Thank you. And a couple of questions. I know you demonstrated a lot of stretches. So what is there any risk of overstretching, or how something like that? Any risk of overstretching any of these muscles?
So I don't typically really focus on static stretching or long holds. We call it like a low, long duration, because everything is already getting so loose with our hormonal changes. So the gentle rocking, all that is good to actively get the muscles moving, but you can definitely overstretch if you're just sitting there and like holding an adductor stretch for minutes on end. We're already also getting weaker. So the more stability we work on, the better.
Awesome. Great. Thank you so much. I appreciate that. So speaking of stretches, what about sciatica pain in the legs or buttock area during pregnancy?
Yeah, definitely. So there's a couple of things you can do with that. Sciatica can be coming from all different places. It could be kind of compressed in the back or in the glutes. And I would say a lot of those gentle core exercises that we were doing before should really help, as well as I mentioned before, kind of like more foam rolling and stretching through the butt. It would be really good, like your glutes, any type of like figure 4 stretch or anything like that should really help with any type of compression that's going on through the back of the glute. Anything else to add, Sarah?
No, that's good. And if you're feeling like very specific nervy feeling, some numbness, tingling, I would definitely come in for an evaluation to make sure it's nothing more serious involved. And then you can learn more specifics.
Great, thank you. And I think we have another question related to exercise. This is a very hot topic. What about are there any exercises that may cause abdominal tearing, and what are some exercises and what may be some things that we can avoid?
Yeah. As pregnancy progresses, you also want to avoid a lot of twisting, because that puts an added strain on your abdomen and your abdominals. If you really work on that transverse abdominis engagement with functional movements, you should be in the clear. But you also don't want to do any like long-standing planks, because if you don't have that deep core strength and stability, you try to pull in from everywhere else, and that can kind of result in this stretching or straining instead of really keeping everything combined. Any other exercises, Emma?
Yeah, definitely. I mean, I think it just depends on your activity level beforehand. And I know, Sarah, in your course, did they give you some like specific months that you should stop planking after? Like
not really. It was focused on, and how I've always kind of taught it is, if you've been doing planks for so long before, you can keep doing them, but I don't want you now 6 months pregnant, be like, hey, let's start doing some planks.
Totally.
To avoid getting a diastasis, and then you inevitably turn into, like, get one. So really modify everything you're doing and don't start trying to learn new tricks throughout your pregnancy.
Definitely. Yeah. And you could always modify a plank by like doing it on like a countertop or something like that.
Yeah.
Great.
Yeah.
Awesome. Thank you. That was super helpful. I think we may have time for one last question. So what will happen to the pelvic floor after birth?
It depends.
Very good question. You know, obviously we are doing the postpartum one, so we're just going to plug that a little bit more. And you know, birth and labor experience is a little bit different. You know, there's no really telling what might happen. I know that's a little anxiety provoking, but obviously you can do all the things that we've said, you know, to kind of help make the process as smooth as possible. And what I would say is, you know, it's different for everyone. So I would say just kind of go in with an open mind, and come see us after if you need anything. Sarah, what do you think?
No, that's the same. Like, the more you try to prepare and the earlier you start in preparing your pelvic floor for the labor and birthing process, typically the better off you'll be. At least that's our goal. However, you really never know what kind of complications you can run into and so on, but you can always come see one of us. We're all over the city, so you'll be in great hands.
Awesome. Thank you so much. So that was our last question. So I want to thank Sarah and Emma for answering all of our questions and providing us with such great information. That was amazing. I know I learned a lot today. So thank you. So we hope today's talk was valuable and that you learned information on pregnancy and the pelvic floor. If we didn't get to your question, we will do so our best to reach out to you directly afterward. But we also be sending out a handout on the important facts for you to have as a reference. And as a reminder, your presenters for today are Sarah Shoemaker, pelvic floor physical therapist from 95 Chambers, and Emma Codman, pelvic floor physical therapist from Union Square. Feel free to jot down their contact information and you can reach out to them directly with any questions and to schedule with an appointment with them. And our Q&A moderator was Chris Cottrell, who is an assistant director and physical therapist at the Brooklyn Heights office. And I'm Nicole Sirach, one of the clinical directors at Spear. Feel free to reach out to us as well with any questions and we can facilitate getting you set up with one of our great therapists. At Spear, we treat an array of conditions from head to toe. And as a reminder, we're open for both in-person visits as well as for telehealth. If you feel that you could benefit from any individualized treatment, please don't hesitate to reach out to one of us individually. We'll personally connect with you to set you up with one of our team members for an evaluation. Lastly, at Spear, we'll be hosting a webinar like this every Thursday evening at 5 p.m. for the rest of the year, covering a variety of topics. And we look forward to seeing you there. Just as a heads up, as we mentioned, we will be having a postpartum webinar on November 12th, where you can learn more from our expert pelvic floor therapists. Thank you all very much for spending time with us today. We hope you enjoy our webinar and we wish you all the best. Be well.
Bye.